This podcast is about the triangle of care between people who use mental health services, their carers and families, and healthcare staff. The Care Act 2014 has put into law carers' rights for recognition and respect when working together in partnership. Carers, their family members, people who use the services, and healthcare staff all are working to the same goal, that's recovery and well-being.
Carers can be of any age and from any background, and involving carers really does have the best outcome. Carers have their own unique perspective and their expertise, which can really enhance the care that we offer.
One issue that concerns health staff when working with carers is the issue of patient confidentiality. Of course, this is vital. However, carers also have the right for general information and for support.
We can often tie ourselves in knots around confidentiality, so how does it look in practice? Well, we might not share what a person has told us about their individual experiences, but we can share information that impacts on the carer, such as just generally how the person is doing and any information about discharge or risk.
Hello, my name's Sagun, and I am a doctor in the NHS. I work in anaesthesia and intensive care, and I became a carer about 2 years ago when my wife, who's also a doctor in the NHS, became very ill with severe depression. Firstly, the carer is the person who is present at the patient's most vulnerable and most challenging times, whereas the clinicians may not necessarily be. So the carer is really it's first aid, is the first port of call, and often the most valuable person to the patient in that regard. It's also important especially in this field of mental health, because sometimes the patients may not be in a position of having capacity, they may not be in a position of being able to communicate, and so the carer becomes their voice, their advocate, their spokesperson, their translator. The most important thing that any clinician can do for a carer is provide empathy. You need to look at the carer with open eyes and with an open heart. They are the person who is there looking after the patient when you are not. They are the person who sees everything that you don't. They are the person who deals with the side effects of all of the treatment, who has to manage the mood swings, the darkest moments, who essentially provides all the treatment that you write down.